An example of intersectionality, policy, and public health. Louisiana has consistently exhibited a number of public health problems throughout the years. Some current issues include high HIV infections among youth ages 15 to 24, high STI infection rates among youth ages 15 to 24, high rates of unattended pregnancy among teens ages 15 to 19, and inconsistencies in youth access to sexual health resources like sex ed and other healthcare services. Youth ages 15 to 24 accounted for 1/4 of all HIV infections in the United States. Baton Rouge and New Orleans ranked second and third respectively for the highest HIV rates in the country. Youth made up almost half of the 19 million new STI infections. And while Louisiana has consistently remained in the top 5 for almost every STI for decades, its current national rankings are number 1 for gonorrhea, number 2 for chlamydia, and number 3 for syphilis. Louisiana also has the 5th highest teen pregnancy rate ages 15 to 19 and the 6th highest birth rate overall. Disparities and adversity cause widespread inconsistencies in youth access to sexual health and healthcare services like sex ed. While many factors contribute to this, laws and policy can play a huge role in setting Louisiana on a course for better health. You see, whether or not to implement sexual health education is at the discretion of the local school district or CMO. This yields 3 possible scenarios: a school with comprehensive sex ed, a school with no sex ed, and a school with abstinence-only sex ed. The first basically doesn't exist in Louisiana. The third offers some information, but isn't necessarily comprehensive, inclusive, or age-appropriate. They also tend to be in more affluent or suburban districts, which means only the privileged are receiving any form of sex ed. The second case tends to be the most common, a school where students receive no sex ed whatsoever. The Real Education for Healthy Youth Act is a bill for a comp sex ed mandate. The youth advocacy organization, Advocates for Youth, got the bill into Congress where it currently has 51 co-sponsors. Some features of the curriculum include both previously existing concepts and methods that have been improved and innovated, as well as vital additions that add inclusivity and transparency to the information. Multiple data sets report that almost any program that reduces sexual risk is an effective public health strategy to address adolescent pregnancy, HIV/AIDS, and other STIs. We also know that teens who receive comp sex ed are 50% less likely to experience pregnancy. Since this is an issue that directly affects youth, young people are at the forefront of getting this bill passed. And though we have a few supporters in Congress, it'll take a lot more work to move the opposition. Students must use the power they hold over elected officials by utilizing informed advocacy methods. Lobby visits and campaign events are great ways to put pressure on politicians in public spaces where they'll have to address your concern. Other methods use the media to gain exposure and promote awareness. More young people equals a louder voice. You can join the movement too. The Institute for Women and Ethnic Studies created the Louisiana Youth for Truth Council as a means to promote and gain support for the Real Education for Healthy Youth Act in Louisiana. Join our Youth Action Network by searching for Louisiana Youth for Truth on any social media platform.